Generally speaking, different kinds of breast cancer treatments can have different effects on cardiovascular disease. One of the prototypical drugs that's used in managing breast cancer patients is a particular chemotherapy called doxorubicin. And this particular chemotherapy is known to be a major cause of heart failure specifically. The heart failure can happen within a year of treatment, but is also a lifetime risk of heart failure that's associated with this particular chemotherapy. And so that's really important for people to be aware of, especially women that are undergoing breast cancer treatment. There's also radiation therapy. Radiation therapy to the chest, it's very easy for the heart to get affected, and radiation therapy usually leads to inflammation, which can end up leading to different kinds of problems like coronary artery disease or blockage of the heart arteries. Diastolic heart failure can also lead to heart valve problems and can lead to pericarditis or pericardial inflammation. So these are all different kinds of problems that can result from radiation, and they don't usually happen at the time of radiation. These are risks that can occur years down the line. We're talking 10 years, 20 years, 30 years down the line after patients have received radiation. So this is a risk factor or risk problem that the patients have to live with. Other drugs like the Taxol that patients receive can cause autonomic dysfunction, which can lead to blood pressures running too low or too high overall. Usually this is a problem during treatment, but people can have neuropathy from Taxol, which can lead to autonomic dysfunction, which is fluctuating blood pressures. Radiation can also do the same thing as well. And then the drugs or the medications that breast cancer patients take for a period of time, 5 to 10 years, the endocrine therapies, right, or so-called hormone therapy that these patients get, right? So that includes drugs like aromatase inhibitors like anastrozole or letrozole or exemestane, or the tamoxifen, which are the SERMs or selective estrogen receptor modulators. These drugs have their own problems. Tamoxifen increases the risk of forming blood clots. The other ones, the aromatase inhibitors, increase the risk of heart attacks and strokes, cholesterol problems, obesity, the prediabetes and even diabetes. So all of these are issues that can result from breast cancer treatment that women and patients overall should be aware of. Because of more of awareness that's created, there are a lot of steps being taken within the breast cancer community to modify the treatments and the doses and also the medications and the duration of medications in order to cause less cardiotoxicity or less cardiac risk or heart disease risks in our patients. And things are getting better from that standpoint. But even patients that got radiation therapy 20 years ago, 30 years ago, I'm seeing now in my clinic because they're coming with heart problems as a result of all the radiation that they received and also the chemo that ends up causing lifetime risks or lifetime problems. So these are very relevant. In terms of African Americans and Blacks in our community, we already know that Blacks are predisposed to having poorer outcomes from breast cancer overall, because genetically from the type of breast cancer that Blacks tend to have, but also because of disparities overall in care, which make those outcomes worse. So there are worse outcomes from a cancer standpoint and overall worse outcomes from a cardiovascular disease standpoint. And so thinking about this overall in our population is important, but particularly thinking about all of these risk factors and how they contribute to problems with healthcare management in the Black population is particularly important as well.